Ruben Bembibre. Please, you must say your name. Sorry. From Miami Regional, USA, delivered the talk on the implementation of opiate addiction tool. Welcome, Ruben.
Okay, good morning, everyone. So I am Dr. Bembibre from Miami Regional University in South Florida, US, and we are going to share the screen. And this presentation is previously recorded. So everybody can see my screen?
Yeah, doctor, we can see.
You can see?
Yeah, we can see, but there is no presentation.
Okay.
Yeah, now it's there.
Implementation of a opioid evaluation tool by Dr. Ruben Bembibre. Background and significance. The opioid epidemic has enormous significance in the United States and globally because of the repercussion for the patient and for all the sector of society. The COVID-19 pandemic has exacerbated an already difficult situation. The importance of proper evaluation and follow-up on opioid dependence patient is crucial. COW is a validated, recognized tool recommended by the governmental and non-governmental entity involved in the drug addiction field. The opioid epidemic is one of the most important health problems in the United States, and it was declared a public health emergency in 2017. Banyan Health System has been recognized nationwide as a drug addiction assessment center. The use of the evaluation tool is considered a key to improve outcome. Finding of the literature. Prior to implementing this project, a significant literature review was conducted. Articles were searched from the various databases, including Medline, PubMed, Cochrane Library, CDC, and Chanel. The articles were targeted around the year of publication of 2020, and a literature review was presented in Tokyo, Japan in 2019. The keywords used in the literature review search were opioid epidemic, treatment for opioid addiction, addiction evaluation tool, addiction crisis in the United States, assessment tool, withdrawal symptom and competency tool. In total, 250 articles were found and 50 were added into the final literature review. So several studies show that the COW is the most reliable tool for opioid withdrawal evaluation. There is a significant correlation between the use of the COW and the ability of the staff to manage a opioid addicted patient and be able to recognize early sign of withdrawal. The research show a statistically significant improvement when using the tool versus when using other methods to evaluate the patient. This tool was played a significant role in decreasing the readmission rate. So the aim of the project was to help provider using an evidence-based tool to help improve the outcome of the patient and help with the withdrawal management for patient with issue of opioid consumption. So the short-term objective was to educate the staff so that they will know how to use the tool, provide the training, ensure that the staff had appropriate competency to use the tool, and replace the previous qualitative method with a new quantitative method when assessing for withdrawal in opioid addicted patient. It was proven that this tool helped provide the highest standard of care for the patient during the staff evaluating the patient in the clinic. The PICO question was, Will the implementation of the evidence-based addiction tool COW in the federally qualified healthcare center Banyan Health System improve the evaluation admission process, influencing the staff competency compared to the current process of admitting patient in the DAC based on drug screen test result and interview over a period of 8 weeks? The project had 4 phases. First, in evaluating the initial competency of the staff in recognizing early withdrawal in patient. Second, train them with the tool, how to use the COW tool, implementing the tool, and then evaluating the staff competency after the tool. The model that was used was the Roy adaptation model, and also the liquid change model was used to help implement the project with the patient. So there was a population of 22 healthcare providers that were using the tool during the whole 8 weeks of the project. Here is an overview of how the tool looks like. Some more data on the tool, the survey from the staff. So overall, it was a huge success. There was a significant increase in the competency of the staff in recognizing withdrawal symptoms for patients that suffers with addiction. And the result from our project was similar to the one found in the literature, as showing the COW as an optimal way to help recognize early withdrawal. The limitation for the project was the time frame and the sample size. The staff competency after implementing the tool increased significantly. The satisfaction of the staff was very high. And this project finally allowed us to implement an evidence-based practice as opposed to leaving it up to the healthcare provider discretion of using a qualitative method. So this project recognized that the COW is a valid evidence-based practice tool to help recognize withdrawal in patient with opioid, and it was implemented full-time as a new way in this practicum site to help treat the patient. Thank you for listening to the presentation.
Wow, I must say all of us enjoy tools, especially if it's a tick thing, because we don't have time to go through a lot of things. I just want to ask one question. This sample group, was it people who take opiates anytime, or is it things that was given in hospital?
No, the facility received patients from South Florida. So the problem is that the evaluation of this type of patient, a patient with addiction, this is an addiction center. And as you know, before the pandemic, before the COVID pandemic, the most principal problem in the United States was declared as an epidemic was the opioid disorders, because we have many dead because of that. So the topic of the thesis was implement the tool to evaluate this patient, because usually we evaluate the patients just for the questionnaire, for the questions, the answers of the patients and the drug screening. But this is not enough. And according to the national guidelines, you need to apply the tool. The tool allowed us that we can recognize according to the score if the patient improve or not improve, or if the patient should be admitted in the facility, or should be admitted in the hospital, or should be followed up as outpatient. So with the tool, everybody have the same, everybody are in the same page. Because, for example, it's not the same that I think that the patient has to be admitted, but maybe another provider think that the patient have not to be admitted, because the answers of the patients not all the time are true. So with the
Yeah.
tool, everybody are in the same page. For example, if the patient was admitted with 10 and the other provider that don't know the patient see the score at the admission, and when he evaluate with the same score is 8 or is 5, so the provider know exactly if the patient improve or not. Also to or decide the patient delivery. So when the patient is ready to go home.
Yeah. So you can actually use the tool for follow-ups like weekly or every
Yes,
week.
you can use the tool to decide the admission, to follow up inpatient, and to follow
Okay.
up outpatient. And the most important thing is to identify if the patient is in risk of withdrawal or not. Because if the
Okay.
patient is in risk of withdrawal and you define this with the tool, he needs to be individualized immediately with treatment and should be admitted. So
Okay.
this is a generalization that we have to do in all facilities because different facilities use different methods of evaluation. But the tool is only one and is the recommended guidelines according to the entities in the country.
Thanks a lot. That was to me very, very valuable because of the tools. It's well thought about because it's just not a tool with questions and it's scientific and people can't actually lie, so you have an idea what's happening with your patient.
Yes, I think that the use of the tools is very relevant in our practice as healthcare providers because, for example, in my PhD, I create a tool to evaluate the stroke patients. And with the use of this tool implemented in computer system, you can define the risk of the patient and what will be the end of this. Tools, the Apache and many, many tools are created to standardize the evaluation of the patients and to follow up the patient because it's very scientific. It's not all that you think, is you have to substitute a qualitative idea, a qualitative evaluation for a quantitative evaluation. And that is
That's
very
true.
important for us.
That's true. Any other